Hello, I'm Dr. Valerie Walker, and welcome to another exciting medical moment. Today, we're going to be talking about vitamin D and what happens when you go to the doctor and get your vitamin D level drawn, and the doctor comes back and tells you you have low vitamin D. It is estimated that between 40 to 50% of the whole world may actually be vitamin D deficient. So what is vitamin D and what does it do to the body, and why is it not good to be vitamin D deficient? Well, first of all, you need to know what it is. It's a disease that commonly occurs in people when they have inadequate sunlight. And the sunlight that we're talking about, and that's why I have my yellow on. You see my yellow for the sun, just to remind you, there are rays that come out of the sun, UVB rays and the UVA rays. And the UVB rays are the main ones that are associated with vitamin D production, because we call vitamin D, believe it or not, the sunshine vitamin. And the reason we call it the sunshine vitamin is because there are chemicals under your skin that when these UVB rays from the sun hits your skin, it converts it through a process in the body involving the liver and the kidneys and all into the active form of vitamin D calciferol. So that's what vitamin D deficiency is. When you're not getting enough sunshine, and today nobody's getting enough sunshine. You know why? Because we're indoors most of the time. We're inside doing computers, cleaning. In the old days when I grew up in the country, I doubted my granddad and those were vitamin D deficient, for the simple reason that they was outside all day long. They were doing farming. They walked most places they had to go to. They didn't drive everywhere. So they got a lot of sunshine and sunlight. But today, if you notice, most jobs that we do are indoors, so we're not being exposed to all of this good old sunshine, and this is what we need to synthesize a lot of vitamin D. So that's one of the reasons. The other reason is that you may have conditions in your body that block you from utilizing the vitamin D, like problems with your liver or problems with your kidneys. That's why if you have problems with your liver or your kidney, you always want to ask your doctor to please check your vitamin D level. And they're going to probably do that anyway because they understand these types of things. And also, anything that could interfere with vitamin D being absorbed into the body can make you have a vitamin D deficiency. So when you go to the doctor and they tell you, oh, you're vitamin D deficient, a normal level is usually between 30 and 100, and they come back and tell you that you are 12, yes, you are vitamin D deficient. So you really want to talk to them about possibly reasons why. And like I told you before, the number one reason is usually lack of that sunshine with them UVB rays coming down, or inadequate intake. And we're going to talk about that a little later when we talk about products like dairy that has vitamin D in it. Okay, so you say, so I'm vitamin D deficient. So what? What happens after that? Well, you need vitamin D because it's a cousin to calcium, and they go together to make your bones nice and strong. Have you all remembered years and years ago, and we'll probably post a picture of that too, of a disease in children called rickets? They were vitamin D deficient, where they were very, very bow-legged and all. We don't see that a whole lot as much as we did in the old days, but rickets was very, very common in young kids. In adults, it manifests way in a different way. It's called osteoporosis, osteopenia, osteomalacia, and all those terms mean is that the bones are getting weak, they're getting fragile, they're not as strong as they used to be, because calcium and all those things make the bones nice and strong. And you see it a lot in elderly people. You see, that's why we don't want older people to fall. So when they fall and they break something, that is a problem. So we always want older people to stay on top of their vitamin D and their calcium, because like I said, they go together. They work together to make those bones nice and strong. So in older people, grandmamas, mamas, it gets worse as you get older. You want to pay attention to your vitamin D level. Other thing is that when we see vitamin D levels that are low, you at an increased risk of fracture. So when you fall, you see that commercial, everybody laughs about, oh, I fallen and I can't get up. Well, that's not really funny. For real, because these people literally cannot get up because their bones are so fragile, they can barely move themselves around, so they cannot get up. So that is just not a good thing. And the problem with being vitamin D deficient, unless you fall and break something and somebody draws a level and see that you're vitamin D deficient, guess what? As you hear a lot of on this show, a lot of conditions that you have are what we call asymptomatic, meaning you can walk around with your vitamin D level being low, being 12, being 13, and not even know it until the doctor tells you when they draw a blood test and they tell you that your vitamin D level is low. So who gets vitamin D deficiency? Who's at risk for it? Well, first of all, your age. It gets worse. Everything gets worse. I tell you, I looked at aging and ran the other way because it is just not fun when you look down the road to aging, unless you're aging gracefully. Age, it increases with age. And that's why we have a whole little supplement program that we'll talk about a little later that we do for people as they get older with vitamin D and calcium, a lot of times combined. People with dark skin. And the reason for that is in dark-skinned people, such as myself, there are layers of skins called melanocytes, and they're responsible for the pigment in your skin, and they're dark, so that your dark skin kind of, remember I told you that you need the sun rays to come in, penetrate the skin, to activate cholesterol, the component of vitamin D that we need. Well, if the sun rays are coming in and then being bounced off because of the dark skin, then you can find yourself vitamin D deficiency, having a vitamin deficiency also. So dark skin. Obesity. We talked about obesity with breast cancer, obesity with diabetes, obesity with high blood pressure. Well, guess what? Obesity has an impact on your vitamin D level, and you can also have a low vitamin D level if you're overweight. So there again, you want to always get down to that ideal body weight, whichever your doctor sits there and calculate and tell you that that's your ideal body weight, then that's what you want to get yourself down to. Another thing is people that has had bariatric surgery. You hear everybody now telling me, I want weight loss surgery. I want weight loss surgery. Well, one of the things that the doctors do that do bariatric surgery is they keep an eye on your vitamin D level because it can go down if you have bariatric surgery. So those are some of the things that we look for when we are searching for vitamin D deficiency. But there again, the most common cause is just lack of good old sunshine. Breastfed babies, believe it or not, can be vitamin D deficient. So we want to watch that, and all the moms out there that are breastfeeding, make sure you ask your pediatrician or your primary care doctor, what about vitamin D, because I am breastfeeding, okay? Now, even though it's synthesized under the skin, and did y'all know that the skin is the largest organ in the body? Even problems with your skin, like people who have generalized skin rashes or really bad skin or anything that can block those UV rays from coming in, can also have an impact on your vitamin D. So we've looked at why you can get vitamin D deficient. Always sunshine. Remember this yellow top, always sunshine. Other things like obesity, breastfeed, and all those things. But even if you are, what are some of the things that you can do to get your vitamin D level up? Well, the first thing you want to concentrate on again is oily fish. Things like salmon, herring, mackerel. Do y'all like any of that? Because I tell patients about mackerel, or sometimes I tell them about sardines, and they go, "Oh, Dr. Walker, I can't eat that. I'm not going to eat that. That would be horrible. That could be the worst thing that ever happened, is me eating a can of sardines or mackerels and all." But actually, they have vitamin D in it. Guess what else? Mushrooms. If you're not allergic to mushrooms, now, there are a lot of mushroom allergies out there, so you better make sure you're not allergic to mushrooms. But if you aren't, That's a source of vitamin D. And then milk. I have this here and I have it turned around so that you don't see like the name brand, because we're not advertising anybody. But just try to find some milk and turn it over and look at the content of vitamin D in the milk. And a lot of products you see will say fortified with vitamin D, meaning they've added vitamin D in there. And that's a good thing. You want to look for that. Things like yoga. A little cup of yoga at lunch time can give you some vitamin D. So you want to look for those types of foods that can help you. Certain juices are fortified, even though you don't want the high sugar juices. You want to try to get a juice that's unsweetened, probably organic, and see if they fortified it or added some vitamin D. A lot of breads can do the same thing. So you want to do that. And then the other thing is sometimes you just have to go and just get some old-fashioned vitamins, some vitamin D. Most companies like Walgreens and CVS and all of them, they always have a buy one, get one free. So you can go in there and get a bottle like this size, and it doesn't cost that much, and get a free bottle, and then you have your vitamin D that you can take. It come in different strengths. 1,000 IUs, that stands for international units, 2,000 IUs, but you talk to your doctor based on your level and see how much vitamin D you need. Now, sometimes you could be so low, the doctor has to give you a prescription, and what they'll give you a prescription for is the 50,000 IUs that you're supposed to take once a week. And when I tell patients, pick the day of the week you like. Sundays or Mondays to me are the best days to start a treatment that you're only going to do once a week, because you'll know every Sunday or every Monday morning I've got to take this little one pill. So multivitamins are good, as are prescriptions. So don't forget dairy products. You can get out in the sun. Remember in the old days, people used to get out and do this thing called sunbathe. You see the ladies laying out on the lounger and the thing, but they're getting sunburned too, which is not good, because we can talk about that in another show. That could lead to all kind of skin cancers. But if you just get your adequate share of sunshine every day on your quote-unquote, remember your 30-minute walk 5 days a week, that would be real good at increasing your vitamin D level. For children, let's just go over what we usually like to do. Is usually 400 IUs per day. For adults with no other health problems going on with their kidneys or liver or whatever, is usually 600 IUs a day. And for anybody over 70, we usually recommend 80 IUs, which is international units, a day for them. This will keep your vitamin D level up to snuff. Periodically, your doctor will check your vitamin D level to make you sure you're doing good. And like I said before, if you have not had any problem with your kidneys or your liver or anything going on, then you should be pretty good. Also, remember, vitamin D is what we call a fat-soluble vitamin, and what that means is it'll do good if you take it with your biggest meal of the day. So don't just take it on an empty stomach, and a lot of y'all rolling on empty stomachs, and that's not good. The human body actually requires 3 balanced meals a day. That's very good for the human body. So you just bouncing out the door and taking vitamin D and running on out the door, haven't had any breakfast, anything to eat, that's just not necessarily good, because you want to do your 3 balanced, you hear me say balanced meals a day, and try to do them at the same time every day. The body loves consistency. Just like you want consistency in your life, the human body wants things to go on schedule in its life also. So on a schedule, and I know sometimes you're busy, you're going out of town, you're going on vacation, but I'm saying the bulk of the time, try to do it the same time every day. Sometimes it's best to just eat breakfast and take your vitamin D in the morning, and then you're done with it. Make sure you're exposed to UVB sunlight at least every single day. Get you some good old sunshine. Get out there in the sun. Make sure you take your vitamins and take them on time. Try to eat products that has been fortified with vitamin D. If you lactose intolerant, then you can get some products that actually say lactose free, or the little lactase, which is the enzyme that converts lactose into galactose and glucose. You don't have to remember all that. That's just for me. You can get some of that too, and that can help you with digestive problems if you are lactose intolerant. So make sure you get your fair share of what we call the sunshine vitamin. I'm Dr. Valerie Walker, and this has been the Medical Moment.